Welcome to SENDiass4BCP's webinar on transitions to adult services. In this video, we will be looking at the provision of information and support, the 8 overarching principles, the transition process, the role of the key worker, non-engagement with services, and where to access some further support should you need it. All children and adult services should give young people and their families or carers information about what to expect from services and what support is available to them. This information should be provided early enough to allow young people time to reflect and discuss with parents, carers, or practitioners if they want to. It should be in an accessible format, depending on the needs and preferences of the young person. This could include, for example, written information, computer-based reading programs, audio, or braille formats for disabled young people. It should describe the transition process, what support is available before and after transfer, and describe where they can get advice about benefits and what financial support they are entitled to. In accordance with the SEND Code of Practice 2015, for young people with EHC plans, the plan should be the basis for coordinating the integration of health with other services. Where young people are moving to adult health services, the local authority and health services must cooperate, working in partnership with each other and the young person, to ensure that the EHC plan and the care plan for the treatment and management of the young person's health are aligned. Health services must cooperate with the local authority in supporting the transition to adult services and must jointly commission services that will help meet the outcomes in the EHC plan. Guidance from the National Institute for Health and Care Excellence provides some overarching principles. That is, that young people and their carers should be involved in the service design, delivery, and evaluation relating to transition. That support should be developmentally appropriate, based on the young person's strength, and use person-centered approaches, treating the young person as an equal partner in the process, taking full account of their views and needs, and supporting them to make decisions. It also provides that health and social care services should work in an integrated way to ensure gradual transition for young people, and they should proactively identify a plan for young people in their local authority with transition support needs. They should also check and ensure that a young person is registered with a GP. If you have services currently involved as a child, then the transition to adult services must begin at least 6 months prior to the transfer. This planning includes support from a named key worker to coordinate the care and support during the transition. The named worker should be someone with whom the young person has a meaningful relationship, and depending on the young person's needs, this person could be a nurse, youth worker, or other health, social care, or education practitioner, the named GP, or an existing key worker, transition worker, or personal advisor. A care plan should be developed detailing the young person's care needs and who will support them after their transition to adult services. The young person should be involved with the service design, delivery, and evaluation of the plan, which should concentrate on what is possible for the young person rather than predetermined options. During planning, the creation of a personal folder should be considered, to be kept by the young person that they can share with adult services, including information such as a one-page profile, information about their health condition, education and social care needs, the history of any unplanned admissions, the young person's preferences about parent and carer involvement, emergency care plans, as well as their strengths, achievements, and hopes for the future and future goals. The young person's support should be identified, which should include, but not limited to, family or carers. It should then be ensured that the young person is registered with a GP who may be able to help with prescriptions or support where services are not available. Named workers should oversee, coordinate, or deliver transition support, depending on the nature of their role, be the link between the young person and various practitioners involved in support, including the named GP, arrange appointments with the GP where needed as part of the transition, help young people navigate services, bearing in mind that many may be using a complex mix of care and support. Support the young person's family if appropriate. Ensure that a young person who is also a carer can access support. Act as a representative or advocate for the young person if needed. Proactively engage primary care in transition planning. Direct the young person to other sources of support and advice, such as peer advocacy support groups provided by voluntary and community sector services. Think about ways to help the young person travel to appointments if needed, and provide advice and information. If, following the transfer to adult services, the young person does not engage with health and social care services, the relevant provider should refer back to the named worker with clear guidance on re-referral if applicable. The named worker should review the person-centered transition plan with the young person to identify how to help the young person use the service or an alternative way to meet the young person's support needs. Under no circumstances should young people find themselves suddenly without support and care as they make the transition to adult services. Although it is important to know that a young person with mental capacity also has the right to decline support. Under the Care Act 2014, local authorities must continue to provide a young person with children's services until they reach a conclusion about their situation as an adult, so that there is no gap in provision. Reaching a conclusion means that, following a transition assessment, the local authority concludes that the young person either does not have needs for adult care and support, or does have such needs and begins to meet some or all of them, or does have such needs but decides it is not going to meet them, either because they are not eligible needs or because they are already being met. The local authority can also decide to continue to provide care and support from children's services after the young person has turned 18. If you require further support with transitions to adult health or social care services, you can visit our website at SENDiass4BCP.org, where you'll find lots of free resources to support you. You can email us at help@sendiass4bcp.org, or you can contact our advice line, open Monday to Thursday, 9:30 till 12:30.